These are the different types of joints in our body.
Now tell me, what are the problems of joints, Surya?
See, Janara, first problems for joints is due to accident and injury. See here, what happens when sudden pressure is put on our joint?
The structure of the knee joint is its cartilage surface. Due to trauma, overload, and genetic disorders, the cartilage surface might be damaged. The patient feels that.
That was horrible, Surya. Now what to do in such cases?
See, Janara, in most of these cases, doctors try to restore your joint. But if the conditions are worse, you have to go for joint replacement.
Okay, Surya. Now see here. This is one more common problem of the age-old people. Rheumatoid arthritis. See here.
Autoimmune disease, where a person's immune system attacks and targets the healthy connective tissue surrounding joints in the body. It affects approximately 1% of the population. Rheumatoid arthritis most commonly affects individuals aged between 30 and 60. However, onset can occur at any age. Women have more than double the chance of developing rheumatoid arthritis. Other risk factors include having a close relative with rheumatoid arthritis and smoking. When the immune system attacks the connective tissue surrounding a joint, this causes inflammation. Patients experience swollen, stiff, and painful joints, which can feel warm. Symptoms are worse in the morning and after periods of inactivity. The most common joints affected are the small joints of the hands, feet, and ankles. However, larger joints may also be affected. Symptoms usually occur symmetrically on both sides of the body. This initial inflammation can lead to long-term joint damage and joint deformities, so early management is key. People living with rheumatoid arthritis experience flare-ups of more severe symptoms which can last from a few days up to a month. Rheumatoid arthritis is mostly managed with medications targeting the immune system, which aim to decrease the inflammation and damage to the joints.
Chandana, tell me the treatment and care for this.
See, the most important aspect in rheumatoid arthritis treatment is to stop the loss to the joint. This can be made by rest to the joint, limited exercises and diet. See here, this is a miracle. Use of olive oil in regular diet helps in controlling it a lot.
That was nice, Chandana. See here, the arthritis can also come from certain virus. We call it as viral arthritis. See here, these are the causes and symptoms. Joint pain, joint swelling, fever, eye swelling.
You are right, Surya. Now see here, this is one more disease which causes joint pain. This is common nowadays. This is chikungunya. See how it comes and its problems.
The rainy season brings with it a lot of diseases. Most of these start after the rains have ended and mosquitoes have started multiplying. This season has got lots of cases of chikungunya and they keep increasing by the day. Let's look at some of the symptoms of this disease. The first and most prominent is excessive joint pain. It begins slowly but reaches an intensity where the patient is not even able to stand up. The second symptom is high fever. The temperature of the body can go up to 104 degrees and last for about a week. Chikungunya also brings with it red patches all over the skin. It also can be recognized from redness in the eyes and dryness all over the skin. It is important for us to recognize these symptoms and act on them. Do not try treatment yourself. Always consult a doctor.
See here, these are the simple remedies for people suffering from joint pain due to chikungunya.
Okay, Surya. Now tell me the major problems of muscles.
See here, these are the major problems related to our muscles. Of all this, hernia is the major one.
Yes, Surya. Hernia is the most common problem in men due to this one called as iliacosa. See, whenever they lift heavy weights, muscles here are taut and can
abdominal contents, such as the intestine, bulge through a weakness in an area of the groin called the inguinal canal. As the intestine pushes through this weakness, a hernia sac made from tissue lining the inside of the abdomen, called the peritoneum, surrounds it. The intestine may become trapped or incarcerated inside the hernia sac. Over time, its blood supply may be cut off, leading to strangulation, where the tissue inside the hernia sac dies. A totally extraperitoneal laparoscopic inguinal hernia repair requires only small keyhole incisions into the abdomen, known as ports. To reach the hernia, the surgeon will insert a tube, called a trocar, through a port located just below your navel or umbilicus. This instrument will be used to separate the inner abdominal wall from the peritoneum. Then, a balloon surrounding the instrument will be inflated to create a space for the surgeon to work. Next, your surgeon will insert the laparoscope through the umbilical port. Images from its camera will be transmitted to a video monitor in the operating room. Once the working space is created, 2 additional trocars will be inserted. The surgeon will pass surgical instruments through them. These instruments will be used to separate attachments to the hernia sac and gently pull it out of the inguinal canal and back into the abdomen. To prevent anything from slipping back through the opening, the surgeon will place a piece of mesh over it and tack it in place. The incisions will be closed with sutures, followed by skin glue or skin closure tape. If there are complications with your laparoscopic procedure, your surgeon will switch to an open procedure with a larger incision.
What is the remedy for this, Chandana?
See, for this type of problem, surgery is the only remedy.
Okay, Chandana. See here. This is the most dreadful disease, called as motor neuron syndrome. This is a viral disease. If this attacks, there is no medicine so far. The patient will lose his weight within 6 months and slowly dies. There is no remedy for this. We are helpless against this disease.
All voluntary movement in the body is controlled by the brain. Nerve cells in the brain, called upper motor neurons, initiate movement for the release of chemical signals called neurotransmitters. The signal is passed from the upper motor neurons to the lower motor neurons of the spine. Nerve fibers extending from the spine, called axons, extend into the muscles. The point where the axons and muscle fibers connect is called the neuromuscular junction. When the signal reaches the neuromuscular junction, it causes the muscle to contract, resulting in voluntary muscle movement. Amyotrophic lateral sclerosis, ALS, often called Lou Gehrig's disease, is a degenerative disease of both the upper and lower motor neurons. As more and more motor neurons become affected, they are unable to send signals for movement to the muscles. Loss of voluntary muscle movement and coordination develop. Over time, muscle weakness and spasms develop. Patients are unable to perform routine activities such as walking and getting out of a chair. Eventually, paralysis develops, interfering with the ability to swallow, talk, and breathe. Unfortunately, there is no cure for ALS. Death from amyotrophic lateral sclerosis usually occurs within 3 to 5 years from diagnosis.
That was horrible, Surya. Now tell me how to take care of our bones and muscles.
Don't be in a hurry. Come. Let's welcome our friends, Rajit and Chandana.